Okay, I think we are live. Okay. Raviji, can I record it in my laptop also? Please give me the permission.
Recording in progress.
Yeah. So, Indrani, I think we are ready to go live. We will go live, and in the meantime, whoever joins it will see. It's already as per the time. We'll see as the now who is joining us. Okay, so all ready? Just a second. Hello and welcome once again to another session of Beyond Education. So, this is another initiative taken by IDYM, and we are here once again on this platform. Very extensive knowledge which will be spread out. And since today is the Daughter's Day also, so we intend to give all the women a healthy life, which we have been for quite a long time taking it back foot. So we need to come in the front and take initiatives that the health of every woman matters. Not one day, not 2 days, but every day. With that intention, IDYM along with CVMG has made this initiative to give a healthy life to every lady who have been working hard day in and day out to bring a society of good people. So the concern for women health has increased multifold right now in recent times. And there has been an increase in the diseases which have been attributed to the recent lifestyle changes of today's woman. The need of the hour is to adopt an easiest strategy of prevention. Prevention means an early diagnosis and a timely and effective treatment. So, with that intention, today we have with us Dr. Indrani, who is joining us all the way from Shillong, Assam. So, Meghalaya, we have Dr. Indrani here. So a little bit about her because everyone, those who are there in Meghalaya knows her very well. But for my people here globally, a small little note about Dr. Indrani. She is working in Nazareth Hospital and she is the senior consultant in HOD Department of Obstetrics and Gynecology in Shillong, Meghalaya. So she has done the heading of OBGYN department of Nazareth Hospital. And also in the clinical work, she has submitted a lot of theses and social work along with that. But I think it's better to know from her about her work rather than me telling, because if I keep on telling more about her, I will take a lot of time and days. But before we start today's session, I would request Dr. Rinzani to just tell us a little bit about her social ventures as well as what she has been doing in Shillong, Meghalaya, with her post as a gynecologist. So over to you, Dr. Indrani.
Thank you, Rachna, for those kind words. And at the outset, let me thank you and your team for this wonderful opportunity today. And I look forward for today's program. So, thank you for your kind words. Well, I'm working as a senior consultant and HOD in Nazareth Hospital, Shillong. It's almost now 2 decades I'm here, and I teach in a DNB institute. So I train postgraduates under me also, And as per the social activities, as you say, I work a little bit on breast cancer and cervical cancer awareness in the community, work for that, so that we can screen patients early, diagnose early, so that they can get their treatment at the right time, because these are the two cancers which are really affecting women, very, like, the spread is too high, the incidence of cancers are increasing in women. And though today that's not the topic, we will be discussing something else today. So I think, without wasting much time, I think we should start on the topic, so that later on we can take queries and questions. What do you say?
Yes, surely we can go ahead. We'll start with today's topic. The main today's topic is about menopause and PCOS problems related to that. So, Dr. Indrani, you can just start with your presentation so that we will take in some more questions once we finish and know about it all, which has really a great connection with the woman. And it's amazing to know from you, you are working with breast cancer, which is one of the great concerns nowadays with the ladies also. Since we keep on avoiding and keeping it as a back foot, we need to bring it now, all this awareness. So slowly, slowly, we will be providing all the ladies this platform so that they can come in and talk one to one with their doctor on board also. So yes, doctor, you can start with your presentation.
So I'll just share my screen.
Yeah.
So screen visible and I'm audible.
Yes, yes, screen is visible. Yes, you're audible.
Okay. So, as you say, today we are talking on women's health, and women's health at every age is important. I'm really happy that you have brought out these two topics, which are very important. Menopause, it's every woman will go through that period, and how to deal with the problems in menopause. And of course, PCOS. This is a topic, which the disease will be having a wide range from young girl to the elderly. The PCOS is a disease which affects in all ages. So I think we can cover up like all the problems in her whole lifetime. So I don't know how much we can cover. So I'll just start. So I'll start with a small poem, and this poem is not written by me. It's someone else's poem, though I want to read it out. So it's like goes that as I struggle to catch a little sleep, hot flushes and sweats into my world creep. My heart and pulse are mounting to race. It's difficult with the daily grind to keep pace. What is it? There's hue, cry, and uproar. It is the brittle hair strewn all over the floor. The fat peeps from all over as multiple folds. Have pity pleads my blouse, no more can I hold. The belly tries to push itself and sit in gay abandon. Exercise and diet control are easier said than done. My pigmentation and crow feet get difficult to conceal. I feel tired. Where is my zest and zeal? Thyroid and diabetes are on the prowl. Why I am irritable? Why do I scream and howl? And as I meet my gynec to know the cause, she smiles and says, "It is the menopause." So this is like in a small way, I'm telling how the women she starts having the symptoms of menopause. So today
Wow.
I'm going to breeze you through the menopause. The women she starts having the symptoms of menopause. So if you see, women, she is the pivot of universe. As you see, you have said that it is around her everything revolves, the she's the axle around which the family, society, and in fact the whole universe revolves. And if we don't take care of women's health, how will she pass it on the next generation? Because she is the mother and she is going to bear the children for the next generation. So it is very important that we take care of the health of women in all the stage of life, and of course more so in menopause also. So it's felt that the menopause is one of the most neglected part in a woman's lifetime, and it should not be so. It is also the part of life where she feels a little bit down, depressed, all her duties are completed, and she's fighting against herself these symptoms of menopause. So why it is important, why these problems are increasing? Because as you see, the life expectancy is now increasing. Long back, 40s, when people were in the 40s, it was considered old. Back in 1900s, maybe way back when our grandmothers or before that time. Then, and on 4 decades back, even 60 years seemed old. But as you know now, with time, with so many improvement in the healthcare, the life expectancy has increased, and people do not feel old even in their 80s now. So you never feel old and remain walking till your final recall. And it is very important that you maintain the quality of life all throughout your age. Now, women, they want their own identity. Like the song which I remember from the movie Guide, आज फिर जीने की तमन्ना है, आज कुछ करने का इरादा है. This dialogue is very close, and the women, they should have this feeling of आज कुछ करना है all along their lifetime. It's not that they have become old and your chapter of enjoying life or to do something, your zeal for life should go off because you are getting old or you're going into menopause. That should not be. So the slogan should be, you are fit at 40, strong at 60, and if, of course, you should be again independent also, even if you are 80. So we've seen many times that this midlife crisis interferes with the quality of life. What are the problems which the women face during this time? There's a lot of weight gain, and there are certain symptoms like there are a lot of mood elevations. They have hot flushes. Sometimes they're depressed. Then there are a lot of sleep disturbances also. And of course, some pathological symptoms might appear. You might have urinary symptoms. You might have recurrent urinary tract infections. There'll be vaginal dryness. And of course, some amount of sexual problems also arise during this time. Then of course metabolic syndrome start to creep in once you age. The diabetes, hypertension, heart disease, these are also at risk during this period. Then osteoporosis, that is the weakening of the bones. This is a very, very common problem the women face during this time. And later on, as they progress, there might be even Alzheimer's or dementia in the later life. So you see, which is the quality of life? Is this the quality of life, or we want this quality of life? Of course, by seeing the second picture, we all want that quality of life for all women. Giving an example of this lady, Bhagwati Oza, she's 80 plus. She's a mountaineer who trained under Tenzing Norgay. She's a qualified pilot, a doctor, and she lives to make her life worthwhile. She has won lots of accolades in her whole career. So even today, she runs 5 kilometers every day, and she cycles also 15 kilometers. She has also received the National Award for Older Persons in the Sports and Adventure category in 2016. And this award was considered to be equivalent to the Padma Shri Award. So what we need is a driving force, for the women. That motivation is what they need to carry themselves forward. So initially, what was the thing? The only tools man had was the two hands. They used to do everything with their two hands. But now, with time, in this mechanized world, you are just using your fingers. At the tap of a button, your works are done. You have your remote control in your hand. With the phone, you can manage everything. So what are we doing? The only weight we are carrying is our own body weight. So what do we need to do? If you see this, what does the statistics say? The sedentary lifestyle, this accounts for more than 2.5 lakhs deaths which are premature annually, because the lifestyle of the people are changing now as compared to the previous times where a lot of hardworking, the women were hardworking. Now It is mostly, sitting job where you finish your job at the, with your phone, or your tap a button and your work is done. So what is the important thing which makes your life 100%? I think it is very important that you maintain the attitude towards life. What should be your attitude towards life? That will make your life complete. So it is our attitude towards life which determines life's attitude towards us. This is a phrase by Earl Nightingale. So every problem has a solution only if we perhaps change our attitude. So we can't help if you don't have a positive attitude. All the female, as they're aging, they should have that thing, that they should have a positive attitude towards life. It's not like, that I'm getting old now, I cannot do this, I cannot do that. So if you don't have that inner self that you can do it, nobody can change you. So you should have your own positive attitudes towards life, and that you need to push yourself a bit more. So the first thing I would advise, change your attitude towards life. That is going to make a big difference in your life. So you change your life as well. Happiness keeps you sweet, trials keep you strong, sorrow keeps you human, failure keeps you humble, success keeps you glowing, but faith and attitude will always keep you going. So living a life that matters, it doesn't happen by accident. It's not a matter of circumstance, but of choice. So it's you, how you decide to make your life. So always have a positive attitude towards life, because you're living just one life. So you need to live life. So what are the determinants of the quality of life during this menopausal times, when you're going through this menopause or this perimenopausal time? You have to have a positive attitude towards aging. You have to accept that you are aging. Definitely you're aging, but you have to have a positive attitude towards that aging. You encourage a healthy lifestyle, and this is all evidence based. First thing, you should not limit laughing to the morning only. There are a lot of laughter clubs which practice early morning laughter. You have to be all along, you have to be keeping happily, and you stay happy, cheerful, and your health will always be good. Try to keep cheerful people around you. All the negativity around you should be taken away, so that you have that positive attitude towards life. And of course, as you're growing old, you retire. If you're working, you might be having a retirement age. After that, we all know this phrase, an idle mind is the devil's workshop. As your mind doesn't move, and this devil, it is the harbinger of the disease Alzheimer's. So always try to keep your brain active. Do work whatever you can in your capacity. Keep yourself busy. Enjoy the simple things. Laugh often, long and loud. Laugh until you gasp for breath. The tears will happen. Endure grief and move on. There are a lot of things affecting your life. You have to move on. Don't sit with that. And the only person who will stay with us in our entire life is ourselves only. So surround yourself with what you love. Whatever hobbies you can keep on doing during that. It might be you can do gardening, you might be doing music, dance, whatever things make you happy, try to do that. Then, like, don't take any guilt trips wherever you're taking. Suppose you are going out, even you're going to a mall for shopping, or you're going moving out of country, going for pleasure trips. Don't take guilt trips. Do not feel guilty about what you're doing, because the guilt will again pull you down. And as you know, the apple a day, as the phrase says, keeps the doctor away. So cherish your health. If it's good, preserve it. If it's unstable, improve it. And of course, if it is beyond what you can improve, you have to get help. And that's when the doctor's role comes in. When you think that you need to get help, it is the right time that you should go and visit your doctor, so that they can help you out. So the major domains of the quality of life are being, belonging, and of course becoming. Now, how this being helps you? What is this being? What kind of being? It is the physical being, that is your physical well-being, your psychological well-being, and of course the spiritual well-being. These three well-beings are very important in your life so that you can easily sail through your menopause. So your health, physical health is important, your personal hygiene is important. It's a very good balanced diet which you need to take. Nutrition plays a very important role in your health. So try to keep your diet healthy, and of course exercise. Then it's also important how you groom yourself. It's not that once you're getting old and all, so I'll stop grooming myself. So your appearance will give you a positive attitude towards your life, so take care of that. Now, psychological well-being, this includes the psychological health and evaluations which concerns the self and self-control. And spiritual well-being, it reflects your personal values, your personal standards of conduct, your spiritual beliefs which may or may not be associated with organized religions. So you have to keep these three things of mind. Then when you start your lifestyle modifications, you have to understand, you can get your menopause. It's around like, the time is around 45, 45, mid 40s, you start getting the symptoms, and slowly it's a transition. And like, so some attend by late 40s and 50s or early 50s. But you need to take care of these changes which are about to occur. If take quite early, you can, so that you can prevent yourself. So you have to start working on that from your mid 30s. Because why is it important? The bone mass and the age, it decreases from your mid 30s onwards. So if you don't take care of your health from that, later on you're going to have a weak bone, which will be easy fractures. Osteoporosis will creep in very early. So it is said that the bone mass loss is 0.5 to 1% per year from 35 years onwards, and around menopause the loss is up to 4 to 5% per year. And the also, if you see, your muscle mass also starts to decrease from mid 30s onwards. So you see, that's a picture of the normal bone matrix and what happens with age. So you need to take care of your lifestyle. So what are the modifications you can do? You have to have a positive attitude, take care of your diet, exercise regularly, then your regular intakes of calcium. This is very important. And then of course vitamin D. In India it is rampant that all females, if you check all females, they will be vitamin D deficient. So it is very important that you check your levels at early time so that you can get the treatment in time. Then of course sun exposure is also important, because vitamin D you can get from exposure to sun. Always staying indoors, inside closed doors, without natural exposure, that is also not good for your bone health. And if you are into drinking also, you need to limit your alcohol intake. And of course, smoking is a big no-no, whether it is active or passive. You have to really take care that smoking should be avoided completely, because it is detrimental to your health. And some amount of meditation will really help you to overcome many things during this time. Now, what are the components of fitness? Exercise, it is designed to improve the 5 key components of physical fitness. What is important here? Your body composition is important. Then your cardiac and the respiratory, your lungs should be good, your heart should be good, so that you increase your respiratory endurance, your cardiac endurance. This needs to be increased, and that will come from your exercise. Then because your muscles are becoming more of like, weakness starts in your muscles, so you need to build up your core muscle strength, and so that your endurance of the muscle increases. And as you see, the stiffness starts coming when you are into menopause. Your joints become stiff. So this exercise will help you to keep your joints flexible, so that you are more healthy during that time. Now, what are the other advantages of your exercises? You will have, definitely there is a feel good factor, your moods will be elevated. The sexuality is also important during this time, so that has also a positive effect in your health. And because the hormones are playing in your body during menopause, the female hormones start decreasing. So it's like, you see, there are certain cancers also start increasing during this time. And as I've said, the joints become tight, so that there is osteoarthritis. You start having your knee pain, your joint pains. You cannot walk for long hours. So those things will help you if you are on a regular exercise regime. And of course, why your that other thing is important is the balance during that time, because these women, at this time, easy fractures happen, even just a small slip, if you're just a small slip can cause you a very major fracture. So you should have that fall prevention is very important. So you need to build up your core strength of your body. Now, coming to the weight loss, this is another problem which the women face during, there's sudden weight gain.
Recording
And
stopped.
this weight gain is mostly, the central obesity. You tend to put on more weight in your abdomen. So you have to work on it. And every time, this is the most important challenge for a woman during this menopause, to keep her weight in check. So you need a lot of motivation. It does not matter how slowly you go, no, as long as you don't stop. You have to have, no, I need, if you are overweight, you need to lose weight. So it should not be that I will do it next week or tomorrow. If you're thinking you will start from today. Maybe in a little, you have to increase it slowly, and then you take small targets. It's not that like if you are 80 kg and in 2 months time I'm going to become 60 kg. Nothing. You have to make up small targets so that you can lose weight over a period of time, because sudden weight loss is also not good for the health. Then again, see, calorie restriction by people, most of us have that idea that if we restrict a lot of calories, we are going to weight loss. So, but what happens during your menopausal period, no? Because here, along with fat, you lose your muscle mass, and muscles are responsible for 20% of your resting energy expenditure, So it is very important that the calorie restriction should be not like, suddenly you restrict all your calories so that you want to lose your fat. It should not be like that, because your metabolism also slows down by each decade. So if you are at the age of 25, you will burn about 100 fewer calories a day at 35, and more less calories will be burned if you are with aging. The calorie burnt is also less. And if you are not doing any exercise, you could really gain, every year you will gain 4 to 5 kgs a year. So it is very important that you balance your nutrition and exercise in such a manner that you keep in your normal weight pattern, that your BMI is normal. So there's a metabolic difference between, the how you burn the muscle and the fat. There's a lot of difference between that. The muscle will burn 3 times more calories. So if you see a woman who's weighing, maybe she's weighing around 80 kg, and she has a body fat is around 25%, she will burn about 200 more calories than a person who has 40% body weight, So if your fat is more in your body, you will burn less calories. So this is typical of a woman who is in her midlife. So now, many of the times, when you are on a diet, you feel that, okay, I'm going to skip the breakfast, because that lot of things are there that I will not take breakfast, so I'll reduce my calorie intake. It is seen that, most women who are skipping breakfast, they are more likely to gain weight rather than reducing weight. Then the other thing is a lack of sleep. It is very important that you have adequate, at least 7 to 8 hours of sleep is very important. If you are sleeping less, you see that you will not lose weight also adequately. A good sleep will help you in losing your weight.
Recording in progress.
So, because what happens if you're sleep deprived, there's a lot of increase in your appetite stimulating hormone, and this is a reason why you tend to eat more also if you are sleep deprived. Now, what kind of exercise will you do? This exercise, simple exercise like walking, cycling. Someone is to dancing, you can keep on dancing. You can do yoga. Then your stretching exercises, Pilates, and some amount of weight training and resistive exercises can also be done during this period. And as a physical exercise important, the mind exercise of your mind is also important. So meditation also plays a very important role. So these are some of the stretching exercises which will help you in maintaining your ideal body weight. And as I said, dancing, dancing is also very important, as some people who really enjoy dancing, it is through dancing they can maintain their ideal body weight. And in today's era, everybody loves dancing. So it's like, you are having fun and plus you are losing weight. You can join classes, you can dance classes or Zumba classes, which will help you in reducing weight. And as I said, of course, give some time to your mind. Keep some amount of your spiritual aspect grow so that you can give time for meditation also. Then, sexuality, it is also one of the major contributor for the quality of life. So there are certain exercises which is very important, because what happens during this time, because of the lack, the ligaments become lax. So there are a lot of things. You might have urinary incontinence also during this time. So some amount of exercise, strengthening of your perineal muscles are important, and we advise Kegels exercise to the patients. And so for proper sexual function, you also need to have your good cardiorespiratory strength building, endurance, because this is also an important quality of life. And relaxation of mind is also there, and there is good interpersonal relationships. I can give an example of this lady, Sharmila Tagore. You can see her with her daughter-in-law and her granddaughter. She looks so elegant at her age also. She goes to the gym, practices yoga, and she's kept her weight so much in check, and she's also very regular. She's one of the finest example, where she's keeping good care of her health, and we can really admire such a personality. One more example I would like to give. This man, I'm just quoting here. I was shocked to see my appearance in khaki. He had his paunch, his jewels, and he started thinking that I should really go to the gym. This was the picture of Amitabh Bachchan during the cinema when he was shooting for the movie Khaki. And now that was so many years back, and now you just see him in KBC. We all admire Amitabh Bachchan, and at his age he's so fit and energetic. So it is very important that you keep yourself fit so that your quality of life stays good. So if you want to be free and flying, you make the journey of life beautiful. Come and exercise, change your attitude, eat healthy. You don't have to do anything. You just have to lose a little bit of your fat in your body. And that will keep your weight at a check, your health at a check. Lot of diseases will be prevented if you are keeping your ideal BMI. Late onset diabetes will also not set in early. Hypertension will not set in early. These are the metabolic disease which will, once you start, these lifelong medications are to be continued for diabetes. So you want to retard the entry of these diseases in your life. So if you keep yourself healthy weight, healthy BMI, so your metabolic disorders will also start late. So, and it is said that a beautiful life begins with a beautiful mind. So enjoy a beautiful life. That's what my message is. So Rachna, I'm done with the menopause part. So if you think you want to sum it up something, then we can a little bit talk on the PCOS.
Said it so nicely, and it's so important that the mind setup right now is so important. And if we can have a stress-free life, then there is nothing more than that. If
Yes.
the stress is something which is disturbing each and every one us, and I feel we all should agree, because the lifestyle now has changed for a woman. Initially, as it is not now the same. We are into so many versatile work, which is also taxing our brains as well as our physical body. We cannot avoid, and all the time we cannot say that later on we will concentrate on our body. If the body needs a call, we should not feel ashamed of visiting a doctor or consulting a doctor. Even it may be a slightest of problem, we should visit. But more than that, as you said, doctor, I truly agree, because I too believe to some extent that when I am very happy, I don't get anything. Just to say a small example, this last, I think yesterday, day before yesterday, I had some sweets because normally now 40 plus, so we are not allowed to have that much of sweets. So I just had sweets, and I just thought I'll do a regular blood test at home. So after keeping a gap, post lunch. So I thought obviously it will shoot up or something. But then I was surprised to see that it is normal. But then in the other hand, my husband, he is totally into the balanced diet and totally diet conscious. But when he did his sugar test, it was high. So this is a good example, doctor. I just wanted to quote.
Yeah,
On a
yeah.
lighter
So you
note,
should not do anything in guilt, as I said. No, don't be guilty
yeah,
about doing something. That
we should
because
be
if you're
happy that
happy,
we're stress free. But
yeah,
we
happy and
are,
stress free. That
yes.
is very, very important in your life.
Yes, so that is where I wanted to give an example that when we are stress free, then obviously we will have no problem. Menopause is something which is really disturbing. I know that because it counts on the hormonal change and all, as we know the clinical side. But in spite of that, if we can accept it as a body change from one phase to the other, then surely I think this will not bring some sort of problems in our body also. So this will not be disturbing. And do you advise that we should do some yogas or something?
Yes, I think I would definitely go that this is very important. Yoga and meditation, it should be made a part and parcel of every woman's life. Yoga will take part of your physical fitness, and meditation will take care of your mental, because the both physical and mental well-being is important at this juncture of your life, because you're going through a change, and you have to accept that change with happiness, and go ahead. Yes, I am into menopause. So what? I will have a good quality of life even after menopause.
Yes, very true, doctor. And if we can talk about the counseling process, is at this menopause period, do we think that the counseling should be done regularly at regular intervals?
Yeah, I think this is very important, because suddenly she notices the sudden changes which are happening into her body. She is not feeling, as I said, suddenly hot flashes. Her menstrual cycles goes haywire. There are different ways which people present during this menopause or perimenopausal, just before you go into menopause. So, like, when do we call menopause? If it's by definition, if 1 year continuously you are not having your menses, then we say that the lady has gone into menopause. Now, before she starts the menopause, before that, from around 2 3 years, she will start the symptoms. She might be having hot flashes, she might be having sleep disturbances, she might be having some mood depressions, she might not, a feeling of well-being will not be there, and plus her menstrual irregularities. There are some people who will, women who will present with heavy menses, some very frequent menses. So during that time, she needs to visit to her gynec, definitely, so that in this checkup she can rule out other causes also, other things which might be, she might be harboring many diseases during this time. So you rule out all, you get your checkup done, so that you can rule out other diseases, and then take care of these problems. There are certain problems which might need medication also. So in that case, you need to take those medications, you have to take the medications. So in case your menstrual cycles are too heavy and you cannot be doing your day to day work because of your irregular menstruation, then of course we advise medications so that she can continue with her normal work. But a thorough evaluation is necessary, and for that we really need to counsel the patients. So during this time she should be in touch with her gynec. So maybe every 3 months she should visit during this period. And then there are certain patients who will go into surgical menopause, because in during this time there are many things which might be pathological, which are occurring inside your reproductive organs. That means, and certain patients might need a removal of the uterus. So in that case, the menopause is also, again, it is a surgical, that's a sudden menopause. So normally it is a physiological change, the changes come over like 2 3 years and suddenly you go into menopause. But if you're having a surgical menopause, again, that is because of your operations in the uterus. So in that case it is a sudden. So in this case also, these patients might need help and medications. So definitely accordingly we will advise them to come out of that problem.
So counseling is good as
Yes, it is
per
a
your.
very important part and parcel of your this period of life, and plus this might be she might need some help, counseling sessions from a psychologist also, because there are a lot of mood disturbances during that time. Sometimes the family members also is important, to take the family members also, because it is the support. She's staying whole day in her house, so if she's not feeling good, the family support is also important. The family members should also understand that something is going inside her, which is creating those problems, like what she was, that energy level is gone down, she's not being able to cope up with her normal activities. So in that case, the family should also come into the picture with the physician, and then they can also help her out of it. That's why counseling is important.
Okay, thank you, doctor. We'll move ahead to the next topic. Then I'll come forward with some more questions.
Okay, so we start with PCOS, and I'm very happy you have taken up PCOS, that is polycystic ovarian syndrome, because this is a PCOS. September month is in our we discuss as the PCOS awareness month. We celebrate the month of September as a PCO month, so a lot of awareness program, because my interest is also in PCOS. I deal with a lot of PCOS also. So and we have been having a lot of webinars on PCOS this month actually. So we want to know what are the myths. We want to discuss what are the myths regarding polycystic ovarian. So this is mostly you can later on have a one-to-one talk and question answers if anybody. So I'll just roughly rush in through this little bit of what are the signs, symptoms, and what you have during this one. So PCOS is subject. It is like it's very controversial. The whole subject is a controversial, and because of the controversy, there's a lot of discussion. So if you see, when a thing ceases to be a subject of controversy, it ceases to be a subject of interest. But PCOS, a lot of new things happening, and this is a disease which can affect a young girl to an elderly lady. There are a lot of in phases it comes. The presentation in each age is different. So it is full of controversies, and that's why it is a very important topic of discussion. Now, what comes in your mind, when you think of any PCOS, you feel really an obese young girl coming into your clinic. She'll have her alopecia or hair loss. Then she'll have extra hairs in her body, her facial hair is more. Then there's arms and legs will have also more hair. Then she'll have a lot of menstrual disturbances. She'll be overweight. She'll have dry skin. She'll have acne or pimples, and many times she'll have irregular periods, or sometimes continuous many months of not having her menses, that is amenorrhea. She might present to you with not being able to conceive. So these are varied symptoms can be presented in a patient with polycystic ovarian syndrome. So hence it's not a disease, it is called a syndrome, because it's a multiple things which can affect to you during polycystic ovarian syndrome. So what happens to these young girls, these obese young girls, they have really go through a lot, not only physically but also mentally, because these patients are overweight, obese. They have the body image, this is body shaming is a very thing which is very common in our country. People suddenly they will use something which might be like very hurting for the girl. She go into depression. She might need even psychiatric help, a PCOS patient. So it is very important we recognize these symptoms early in young girls. So what happens, in a normal ovary, what happens? In each cycle you menstruate, and the mid-cycle you have your ovulation. What is called ovulation means that is the release of the eggs. Every month you release your egg, and then once the eggs are released in the second half, then you again start menstruating. So the cycle starts like that. The menstruation finishes, then again the ovarian follicles start growing. Then mid-cycle you release the egg, which is called ovulation, the medical term, and then slowly over the next 14 days, slowly you again start your next menstrual cycle. But in polycystic ovaries here, there's a problem with the hormones here. What happens? The follicles, the follicles, they don't grow as required. So what happens? These follicles stay as immature. So there is no ovulation here. The patient does not ovulate. That means the release of the egg does not take place, and this immature follicle stays in your ovary. And that's why the picture also in the sonography picture, it can be seen as multiple follicles which are not ovulating. So if you see the incidence, 1 in 10 women will have PCOS. It is a very high incidence of PCOS nowadays, as we see. And it is like almost like an epidemic, And 10% women of childbearing age are estimated to have PCOS. That more than 50% of the PCOS will remain undiagnosed. They are not aware that they are having PCOS, so there's a delay in seeking help. Then 50% of women with PCOS will definitely land up in diabetes in her later life. And it is estimated, if you see the US, the 4.3 billion estimated annual cost to the American healthcare system to diagnose and treat PCOS. So you see the health burden with the PCOS. And it is seen that, there's a 3 times increase. The patients who have PCOS, they have seen a 3 times increase in the risk of developing, that is endometrial means the uterine cancer in her later life. So what is the primary problem here? One is that the ovaries fail to ovulate, and then again, because of this metabolic hormonal disturbance, there is insulin resistance. Then these lead to obesity, hypertension, and you will have your lot of macrovascular disease, your lipid profile gets altered. So you will have a lot of metabolic derangements when you are having PCOS. Then these other young girls will have this problem of acne. Then she'll have a lot of facial hair, plus she will have hair loss also. So here again, it is very important how you are taking up this problem. Lifestyle modification is the cornerstone for treatment of PCOS. So again, I will stress on diet, exercise, weight loss, your behavioral changes, and if you're smoking, you need to stop smoking. And it requires a team approach, to treat a patient with PCOS. You have to have a proper dietitian to give you a good advice. You need a physiotherapist who will help you in your exercise. You need a counselor because she'll go through depression because of her obese, body shaming. She might need a psychiatric help. And of course, the gynecologist and the physician, if you're having diabetes, she also comes into the picture. Now, weight reduction is important here, very important. So it has to be healthy eating and regular physical activity. And it is very important that you keep small targets. Again, I'm telling small targets. In 6 months, also, if you can lose 5% of your body weight, that is more than enough. So the targets should be small. Over 6 months, I'm going to lose this much kgs. So it is seen that 5 to 10% weight loss in those with excess weight yields SMART. That is this. Remember this SMART, the specific, measurable, achievable, realistic, timely goal setting. Don't set unrealistic goals. You are 80 kg and yes, doctor has told me to reduce my weight. So I'll go to the gym. I will exercise day and night. I will stop eating, and in 2 months' time, I will come back to my original weight. No, never do that. So you set your goals, which you are achievable goals. And of course, the psychological factors need consideration. Stress needs to be avoided because, with these young girls, especially I'm talking of young girls, they have a lot of other pressures. Peer pressure is there. They are studying. They have academic pressures. So it needs to be taken care of in a very sensitive manner. Then diet, as you have to totally maintain a healthy diet. Nowadays, young girls, not only girls, everybody, the young population nowadays more into this junk food. They all like to eat only junk food, and nowadays the options are great. You just have your phone, you have Swiggy, Zomato, the food is there in your, if you're not staying at home in the hostel, they'll come regularly. So it is very important that you have to avoid junk food to maintain your body health. Eat healthy, healthy nuts, a lot of greens, vegetables, fruits, fish. These are the important ingredients in your diet. Then one more thing, how do you manage your diet? It's seen that in the evening times, it is mostly, try to avoid on carbohydrate more in the later part because the metabolism becomes slow. So if you are a rice eater, more of carb, try to take that in the morning lunch hours. In the dinner, try to restrict your carbohydrate intake. Then you spread out, instead of having the 3 large meals, try to have small meals frequently. You divide your meals, small meals, but you can take frequently. And then as I said, nuts are very good. They will help you fight against this insulin resistance because insulin resistance is an important thing in PCOS. Then you have to choose your foods like with low glycemic index. If you go to a dietitian, there can be very examples. Many of us don't have any idea about what is the glycemic index of each food. We think that this has a low glycemic index and this is a high, but actually if there's a chart which have you can take with what are the foods which have a high glycemic index. So try to avoid those foods which have high glycemic index. Take foods which have low GI index, and they will also reduce your cravings. Then vitamin intake is also important, which will come from your diet. Definitely, no, the balanced diet you take, the vitamins will come. And if you are deficient, then of course supplements can be given. Sufficient amount of calcium, like milk intake, dairy products, these are also important. Cheese is an important part in your diet. And of course the minerals like magnesium are also important in your food. Then workout, as I've said, this is very important to bring things under control. It is not only the diet or not only the exercise, both things have to come hand in hand to bring your hormones in the normal level. So how do you go for exercise? You can just divide, 3 times a week, minimum of 250 minutes of per week. So you divide it. So maybe if these are young people who might not have time with their other pressures, so if 3 times a week, make it either you're walking, maybe 40 minutes of brisk walking or some light exercise, or once a week you can do some heavy exercise. So this you can do alternatives or thrice a week. And then screen time for young people. Nowadays what we are seeing, that the young children, they are only on that screen, and it is more so we have seen during this COVID times when their schools were closed and all. No, you had to give them a device now, because without device they could not attend their online classes. So either they are on the device and then they're eating and in the device. So the life has become sedentary, sitting in just front of the computer. So you have to take care that you have to minimize the screen time for all children, or young girls, so that they minimize the screen time and more into physical activity. Now if you go to the little bit, like from the younger age, there's more of menstrual disturbances and like weight gain. But if you see next step, when she's about to born children, she's now a lady who wants to conceive. If you see these female infertility, there are a lot of causes. There might be tubal factor, there might be problem in the uterus, there might be ovulatory dysfunction, and out of this 40% of ovulatory dysfunction is accountable for infertility, and out of this 40%, 85% are patients with PCOS who will present to you with infertility. So that is again a big challenge, how you have to go ahead with these patients so that they can also conceive and get pregnant. So again, it is associated with high levels of this hyperandrogenism. That is, little bit of the male hormones are increased here. That's why you have this excessive hair in your body. Then again, infertility is there, as I said, difficult concept in that midlife. And but most important, the later life, sequelae of this PCOS is diabetes, lipid profile disturbances, and of course, this is an important thing that I said, uterine cancer, that is endometrial cancer. These patients are at very high risk of developing 3 times increased risk of endometrial cancer. Then of course, because if you are obese, you will have obesity problems, sleep apnea syndrome. So it is all related to one such problem. So you need to take care of it as a whole. So you may have to fight a battle more than once really to win it, because it is a disease which is going to stay with you. So whenever I'm counseling my patients, I tell that it's not that I'll give you medicine and you get rid of your PCOS. You have to learn to live with PCOS, and how you live it with PCOS, that is important. So thank you all for your patient hearing.
Yeah, thank you
So
so
I'll just
much.
stop my screen share so that we can have whatever discussions, anything.
Yes. So it was really nice seeing everything, because this is really
Rachna, your voice is less audible.
fun. Yeah, now can you hear?
Yeah, I can hear you now.
Okay, so just now we had seen with the presentation, it was very clear to us that PCOS is a syndrome which we should, if it is there prevalent, we should learn how to live with. We cannot just take it out from the mind and come to abrupt decisions that we need to change it as soon as possible. It can be done slowly and steadily, because if we do it abruptly, then obviously there'll be stress. Then again, a lot of other things will come up. So we can do this totally at home with a diet control. That is one such which you have advised, and with our proper diet, this PCOS problem can be, taken out to some.
Cornerstone. Diet and exercise is a cornerstone for PCOS. Little bit of problem is there if the patients are. We have a two varieties of patients in PCOS. One is the obese group, one is the lean group also has PCOS. So it is very easy with the obese. No, you can tell them to cut down on their weight. It is more challenging to treat a lean PCOS actually. The patients who are thin PCOS.
Yeah. So I just wanted to ask the doctor that.
Yeah, louder, Rachna. Your voice is again. I'm not.
Okay, okay,
Yeah.
yeah. And now is it audible?
Yeah, yeah, it's okay.
Yeah,
Yeah,
yeah.
yeah.
So I just wanted to ask that is there any cure? Because already I got to hear something from you, but I just want to know that is there any proper cure for PCOS, or will it remain to some extent uncured, or it will be that we
See,
have to stay with it?
no, see, it is that's why it is not a disease which can be cured. That is why the before the naming was polycystic ovarian disease. You know, a long time back it was said, 10 years back maybe. I'm not sure when it was said polycystic ovarian disease. But now, over years, with a lot of research, we've known that it's a combination of many things. That's why it is called syndromes. And syndrome is something. Disease can be cured. You give medicine, my disease will be cured. But a syndrome you cannot get cured. But yes, of course, you can keep it under control. There are a lot of things which will help you in living your life with PCOS. As a normal person, you can live, but you need to take care of that.
So, doctor, another one more question which I wanted to ask is that
Yes.
a woman is overweight, right? Which you said, and will that losing that excess weight will help her to become pregnant, and or is it okay that in that overweight she can also conceive?
No, no, no. Yes, that is very important. The obese patients who are presenting with infertility, it is very important that they lose their weight before they plan the pregnancy. That will give a good outcome. Just getting pregnant is not important. It is how important that you carry a healthy baby home. No, that is the definition. You have to carry a healthy baby home. The pregnancy should go without complications, without complications. So for that, it is very important that she maintains an ideal body weight before she gets pregnant, so that she doesn't get the complications. Because one of the main complications of PCOS in pregnancy is they are going to have gestational diabetes mellitus. That's the pregnancy diabetes. And this diabetes in pregnancy, this again causes a lot of maternal and fetal complications. So it is important that she loses her weight. At least that's what I'm telling. Take small targets which are achievable. Then the outcome will be better. So we cannot, if the patient conceives with PCOS, with who's a obese, we will not tell her to discontinue the pregnancy. But the complications in the pregnancy will be far more than a patient who is having a normal body weight.
Okay, so this is quite eminent nowadays because I see my students also overweight and plus size and all. It's
Yeah.
not about body shaming, but it is about the food habits which they are practicing nowadays. As a result, the young people, I'm not talking about 40 plus. Earlier, we used to see that ladies crossing, but now, as we saw just now in your videos, and even I know few of them at even 75 plus and 80 plus, they're so healthy and running marathons, and
Yeah.
it is possible. It is possible. By looking at your presentation, also we have seen our famous rock star Amitabh Bachchan, how he can maintain at this age.
Yeah,
So
yeah.
why not at any age? And if it starts, it's always evident that we can finish it. I just wanted to ask one more question, doctor. That the GI index we're talking about, which is very important. So can you please tell us exactly what is this and which food are we talking
Yeah,
about?
yeah. So you see, like for an example, like glycemic index, for example, a fruit, like, so I'm telling you know, like apple and all, they have low glycemic index. It's like fruits should be an essential part of your diet. No? So usually in patients who are diabetes, we are very strict about the glycemic index. No, they are already diabetic, so they need to control their sugars. You know that, no? Someone who is PCOS, I'm telling you, there are a chance that later life they will develop diabetes. But those who are diabetic, they already know that no, sugar is a strict no. But in PCOS patient, we try to give them. So, like example, I'm telling you, you're taking rotis. No, try to take rotis with, instead of that refined flour maida, shift on to atta or some other grains. There are a lot of other things now, ragi and this that is available. No, these are again, then among the fruits, no, we have a concept. watermelon is like, it's all watery, so the glycemic index is low. But that's a misconception. The glycemic index of watermelon is again a little higher. In fact, or apple and orange will be more beneficial than a watermelon, because but that concept is there, no, it is watery, so it's like, it's not too much of calories, but the glycemic index of watermelon. So these are certain examples, no. Then like, carbohydrates, the rice is something we all know that it is a high glycemic index, no. Potatoes, they will have a high glycemic index. So all that's carbohydrate content should be less. So shift on to other foods. So if you're taking your breakfast with cornflakes, I think instead of cornflakes, it would be better if you try with oats, which have a low glycemic, and cornflakes will glycemic index is a little bit higher as compared to oats. So certain modifications for a diabetic, strictly you have taking diabetic medications, and a strict no, because they're already diabetic. But these patients, we can counsel our young children to at least take healthy food, and a lot of they into a lot of soft drinks, juice, they can't have food, they don't like, when we take water, no, nowadays the children I see, they want juice, they don't take water. So the liquid is juice, not water. So encourage them to take more water. It's normal water in your diet, instead of taking all those carbonated drinks like sodas and all. No, that is too much. Burgers, they are more into French fries and burgers, potatoes, fries, chicken, KFC, all these things. No? Once in a while you want to do, okay, once in a month. So the parents also should be very strict about these food habits. It is very important, because childhood obesity is increasing, and with this childhood obesity there are a lot of problems creeping in.
Yes. Yeah, that is true. And even to tell that even I don't want to drink that plain water. I fruit drinks with me, and instead of the plain water, so I was feeling very this thing that yeah, it is very true that nowadays we have I don't know, something has changed, or probably, or why we are not turning into water. We just want some drinks, some soft drinks, or
Yeah, yeah, yeah.
aerated drinks, maybe some fruit juice or something, real
So if
juice.
you're taking fruit juice, try to take fresh fruit juice instead of this packaged fruit juice,
Okay.
because they will have definitely the glycemic, because there's a lot of artificial sweeteners there.
Okay. So, doctor, coming back to one more thing about the menstrual irregularities. So, what sort of advice would you like to give to the youngsters who are suffering from that? Because personally, also speaking, my daughters, even at this age, I have my regular periods. So, still till date at this age also, my periods are quite regular. I have it 3 days continuously at proper this thing, but my daughters, they miss it out. So, considering that, what advice should be given to youngsters in general?
Yes,
Because
in general, see, if they are having, if young girls who are not married, who are not into like reproductive age, they have not reached, young girls, if they are having irregular menstrual cycles, it depends on how much is it. So something is that, one thing is that in this sort of patients, it is important that they have their menses. It's not that everybody will have a 28-day cycle. It is not mandatory that you will have a. So some cycles will be 35 days, some might be 25 days. So you try to see that your cycle comes in every 40 or 45 days, because mostly in this sort of patients we see they have prolonged periods of missed menses, 3-4 months they don't have menses, then they start bleeding. So to ensure that we have, if it is persistent, one off cycle, you're not getting 2-3 months for one time, that's fine. But if it's a continuous process that you're always skipping your menses, then maybe at that time she will need some medication so that her menstrual cycles become regular. We advise certain pills which will make the cycles regular. But other than that, if she's like, not into a healthy lifestyle, this is also important, that lifestyle modification will itself help you in bringing your menstrual cycles regular. Good diet, exercise, lot less of stress, no mental stress, that will also make your cycles regular. With lifestyle modification doesn't happen, then of course you can advise medications. We usually give medications to prolong periods of amenorrhea, like, then they need to bleed also, because if they don't bleed, then there are certain complications which they will have. And the patients who are having more bleeding, one is the group of patients who are not having menses, the scanty menses, or not having menses, and the other one is that they are having their menses so much that it is they cannot do their day-to-day activities, like, they will miss their schools because of their menses problem. So in that case also certain medications can be given so that they can carry on their. So menstruation should not be something which will stop you from doing your normal activities. This is a part of your thing. You have to carry on your activities with the mens. It's not that the 3 days I'm going to stay in bed. So if you're having such symptoms which make you put in bed, then please consult your doctor so that she can give you medications and you can carry out your normal activities.
Okay, okay, got it. And one more thing, which there is also a hush hush about it, that after 50, it is supposed that the menstruation cycle should stop. But then when people are already having, like I am still having it, so then there is a thing that, oh my God, how is it happening? Is it really bad, or is it going to affect the health, that even if it is continuing at a regular speed?
No, some people, that's what I say. No, 45 to 55 is the like background where you're starting your men. Some will start at 40. That's a standard. At that, some might get at 40 also. That's a little bit of early
Not the
menopause. Some
health
might.
or
So
somewhere.
45 to 55. So it is a gradual transition. So in that period, if you're getting your menses, it's fine. But if the menses are irregular, or if the menses are heavy, or it's coming every, it's not the regular menstrual cycle, it's something abnormal, then you need to evaluate that, because this is the time you need to screen your cervix, cervical cancer, endometrial cancer. Screening is important. So you need to visit your doctor to get a pap done, or check, just have a internal examination done by your gynecologist so that everything is fine.
Yeah, so that means it's not that dangerous to keep on having it even after 50 or 55 or
If
something.
you're having it regular, it's fine. But if it's not regular, on and off, it's coming, it's stopping, and sometimes heavy, sometimes not coming, those will need evaluation.
In the regular process, then there is no tensions, right? Yeah, okay. So one more thing, that there are certain restrictions when the uterus is removed. Because some women go for it, as you had already said in your prior this thing, that when the uterus is removed, what are the cautions or the precautions the woman should maintain at that time, which she is doing it not naturally, it is unnatural, it has to be removed, or due to many these things. So is there any restrictions she
Yeah,
has to follow?
restriction as such in any surgery, it needs time to heal. So that immediate post-operative period, she will be a little bit taking rest, not doing heavy activities, and these are certain restrictions for any major operation. First 3 months will be a little bit restrict. After that, she can carry on her normal activities. The only thing that her menopause is like sudden. It's not a transition. So in case these symptoms which happen in menopause, like the hot flashes, or so these might be a little bit enhanced in these patients, no? Because they're not going through the natural process. It's like suddenly you're doing something, no? So in that cases, if she needs help, we can give her medications to solve those problems. Okay, and slowly by a few years, she gets adjusted to that life of the changes which has happened in her body.
Okay. So is it really true that pregnancy can cure the PCOS problem? There is also some saying like that, though if you have PCOS, then wait for your pregnancy and it will be solved. So
See,
is
I'll
it?
tell you. I'll tell you the thing. Why they say that pregnancy will solve the PCO problem? That's a myth. How the saying is a myth. It's that because the PCOS patients have difficulty in conception. That is the biggest challenge. No, PCOS who are real PCOS, they have difficulty in conception. So once you get pregnant, right? Once you get pregnant, your half the problem is solved, because you're already you've got your thing. So that is the saying, that it is solving your problem because you've got pregnancy, right? But follow up after that also, if she has menstrual disturbances might continue, then she might need something. If she is continuously having her menses and she doesn't have any other symptoms, then it is fine. And usually for those young girls who have that, and because of the androgen, the facial hair and all, nowadays there are a lot of good treatments which you can do, because this is a little bit of it's important for girls, if they have a like hair distribution over the facial hair and all, they're a little uncomfortable. So we have a lot of treatments nowadays which can take care of your external part with the symptoms of PCOS,
That
which can be
would
taken
you
care of.
suggest for that IVF this thing also, the IVF?
No, that will depend. Yeah, in patients who are infertile, who are not getting pregnant in the normal, so there are step-by-step methods with medications not happening. Then there are certain assisted reproductive methods. You might have to take help to get pregnant in patients, because there's a problem in her ovulation, right? So we might have to give drugs which will stimulate her ovaries, and then she might land up in IVF.
So the PCOS normally starts with the people at the young age, right?
Yeah, nowadays we are seeing PCOS very young, now. Previously it was like, okay, at least 20 plus. Nowadays, even 14, 15 years olds are presenting with this sort of. This is because the lifestyle, that has changed totally. The young generation nowadays have changed their lifestyle. Huh? You see more of obese children in the school also nowadays. Previously, we never had so many obese children in the school. Nowadays, you see, if you compare in a class, how many obese children are there in the class? So
Yes.
things are changing, and it's a cycle. PCOS is it's like, it's like mother giving PCOS mother giving birth to a child. Hmm? That also reflects in the next generation. Her chances of having PCOS is also more. So it's
Oh,
like a continuous thing which is happening. No? So that's why I said it's like an epidemic now. PCOS is like an epidemic.
okay. So that means so we need to visit the doctor regularly and consult our doctors also.
Of course, yeah. So that you have to rule out, whatever problems you are having, that needs to be ruled out.
Yeah, because
That it's not something which is grave. If you're on time, you visit a doctor and you get your things done, that no, my disease is not any serious disease, you rest assured, right?
it's actually, I believe, doctor, that it's about the style of living. The living style has changed as we were born and brought up with our mother. So as a result, my cycle still now continues as it is. And I don't know, probably with my daughters, I have not been able to maintain that lifestyle. And as a result, they are coming up.
Yeah, now things have changed from what was years back when we were children. No? Things have
Yeah.
really
So
changed.
they have now come up with all these problems. Yeah, the out junk foods are a real factor, which is
Yeah, because during those days we never had so many outlets for junk food. There may be only small one or two where there was a customary once in a month you go out with your family. Now outside the school canteen also will serve you junk food. Inside the school premises also you'll get junk food. College premises also you'll get junk food. And obviously that carrying tiffin from our days, it is like, mummy will prepare the tiffin and we'll have to have the tiffin during the lunch break. Now here many of them will not carry tiffin. They will ask, Mommy, give me money. I will go and eat in the canteen today. I don't want tiffin. It's come like that, right?
yes,
So
yes.
it's not only that, the whole thing has changed, the lifestyle of what previous. So diseases have also increased accordingly.
Yeah, before we end up, I just wanted to know a little bit about hirsutism. Is it a cure or a treatment for?
That's what, no? Hirsutism is a part of one of the presentations of polycystic ovarian syndrome where you have excessive hair where you should not have. Like, it's a
Yes,
male pattern of hair. Like, you have facial hair, here, this is the area, huh? This is the area, like the male pattern of hair. Huh? So, in these cases, when there are certain drugs also, but more than drugs, nowadays we have a lot of laser treatments which are available, no, which are give a permanent cure. So there are laser treatments. It's not that one sitting; multiple sittings are required, and then it's like, you can't even make out that she had so much of hirsutism. These can be taken care of by laser treatment, which is recommended. And other than that, we have drugs also. But nowadays, more than drugs, if you go to a good place, you should know where to take care of your hurts, not go here and there with a good person who can really know how to do because these laser treatments also should be done in a proper place, that there should be expertise in a person who is doing the laser treatment. They know the place, how to put the laser, how much to give. No, those things are very important here because something you're doing on your face. So if with good laser treatment,
okay.
it can be taken care of permanently.
Yeah. So thank you, doctor. I think you have covered up many points and which we really wanted to know. And we were also live on our YouTube channel also. So it is really nice to have you, doctor. We'll be having you more such sessions with you. I know PCOS is a very big topic and
Yeah, I just try to summarize.
there are a lot more questions which we all will be having. Soon after the session, we'll be coming up more with such questions. So we'll have love to have more such sessions with you in our platform. And it was really amazing to have you today, Doctor. I know you are very busy, and this month being the PCOS month, as you said, and we were lucky to have you amongst us and know many things which was really a taboo or a myth which we already followed always. And this has to some extent been removed. But still, the question will come up as we need. So it's an advice to everyone that always try to release your stress. Stress is the main cause of all the disease. So if you can leave a smiling face, that is your main limitations to your healthy life. If you want to live a healthy, do what your mind tells you to do. So I believe in that because I always tell everyone. I think I remember I had a talk with another doctor in a doctor's meet. So I said, doctor, that if a patient, a cancer patient, so she was very, very positive towards her life, and her cancer doctors had told very few days are remaining for her. But when she was trying to live her life, it went from days, it went to months, and from months, it went on to a couple of months, then to many months. So the main thing is that, as you already started it with, also that
Yeah.
lead a stress-free life.
Your
All
attitude towards life is the most important thing in life.
and do what you want, dance, sing. This will rejuvenate, and
Yeah.
your cells in the body will never die. I feel that. I don't know. Probably I do that myself, except for my body weight. Rather than that, touch wood. As of now, I don't have any such a doctor problem, except my weight of the body, which is consistently increasing, and that is of course my diet is there in
So
concern.
maybe you need to little bit concentrate on your diet. I think that should solve your problem.
So always smile. So our advice to everyone who has been watching, as doctor said, live a stress-free life. Always do what your mind tells you to do, but never delay to consult a doctor. Never take a back step to think that tomorrow I will visit a doctor and solve my problem, because the tomorrow makes all the problem. So being a lady, you are the maker of the home and the maker of a nation. So
Yes.
your health is a prime concern. So if you are unhealthy, if you are trying to give priority to your other family members rather than you, then it is high time that you come up with, we are there to support you, but you have to take a front step. Visit your doctor next door, consult if you are having certain problems which you are not able to cure, as doctor said. So those who have missed out, do visit our live channels where we have been live, and put us a question so that we can take that question later on. Thank you so much for being with
Thank
us.
you. Thank you so much for the opportunity, Rachna. It was nice
Yes,
interacting with you today here, and I hope to continue with you
yes,
people in
sure.
the future also. Thank you so much.
As we always have you, and we always love the positive aura which you spread, doctor. And that
Thank
is
you.
where we all need nowadays. For me, the prime concern is a woman's health, because the woman is the maker of the nation in the long run, though everyone agrees or not, because the family runs from the woman. If the woman of the house is happy, if the woman of the house is healthy, then the full family is healthy. If the family is healthy, then the neighborhood is healthy. Then, if the neighborhood is healthy, the state, then country, and the whole nation. So, my
Yes.
prime concern is always with a woman's health, giving the top priority. So, thank you for your cooperation always, and taking out from a busy schedule time for us over and again. From IDYM as well as from CVMD, I would like to thank you, Doctor, for sparing your time
Thank
and
you.
being connected. Thank you so much.
Okay. Thank you. So we leave the meeting. Thank you.
Recording stopped.
So, can we close the meeting?